South Africa is often said to have some of the best policies in the world, and yet suffers a huge execution or implementation deficit. Well, yesterday, the Human Sciences Research Council and Uganda's Makerere University School of Public Health held the Complexities of Policy Implementation seminar. It was entitled "The Role of a Policy Implementation Barometer in South Africa and Uganda." The project wants to encourage and support policy engagement for evidence-based decisions. From the HSRC, we're joined by health economist Professor Charles Hongoro. He is accompanied by Professor Freddie Sengoba from the University of Makerere's School of Public Health. Good to have both of you. Thank you very much for joining us on the program.
Thank you.
So if I may begin with you, Professor Charles, you reckon that South Africa grapples with the implementation of poor policies like the national health insurance. What other policies are gathering dust in the halls of wherever they sit, waiting to be implemented?
Well, I mean, there's quite a suite of policies that we have, either that are not being implemented or being implemented slowly. I do not have a list necessarily with me, but one of the things that you mentioned, obviously, is the question of NHI. But NHI, I wouldn't consider it as a policy that is out there already to be implemented, because it's still in the making. But I think overall, when you look at outside of the health sector and you begin to look at other policies, even in agriculture or where we talk about land reform, there's the whole debate about where are we and why have we not yet implemented some of these policies. So the idea was to say, look, how can we identify some of the bottlenecks or the challenges around policy implementation in general, but with a particular focus at policies that relate to our aspiration of trying to achieve universal health coverage. That's why I'm making reference to NHI. But we have a lot of other policies, around human resources for health. We have policies around health promotion. So there's quite a number.
There are many of them. And I think South Africans are aware of them and are frustrated by this. But let's bring the issue of Uganda onto the table, because this was between South Africa and Uganda, which is an interesting partnership, which I'll ask you where the decision came from to do this. But first, Professor, for Uganda, the project wanted to use, and I read here, supporting policy engagement for evidence-based decisions, called or SPEED, as you like to call it, for universal health coverage. Is this a big challenge in Uganda?
It is actually a big challenge. Like here, I think across the region, we are blessed with many policies, but we were cursed with inadequate implementation. So we have been having child survival policies, maternal health policies, and over the years we realized that there is a big dilemma around implementation. Somehow we have lower level interest in monitoring and evaluation, and people there have a lot of data and they use it, but doesn't speak very well to upstream, people who make decisions at higher level, institutions that come together. And so over the years we realized that we are making a challenge, we're having a challenge of having 20, 30 agencies that have to come together to implement. And somehow there isn't sufficient leadership to mobilize them to work as a team and be able to achieve that common goal. Many times they sack a minister there, or we abandon the policy, or generally blame the health workers on the ground. But there is a lot of up and down interaction which is missing, and we thought we needed to get an innovation like a barometer to be able to speak to both what is required up to support down, and also how to engage these two so that they are constantly in discussion to solve problems. Because people come usually to talk about how big the problem is, but to mobilize them to solve a problem together.
That's where the problem is. And that's what I suppose we need to start concluding the interview with, exactly that. So you've got this barometer, you've held the seminar. So the question is now, how do you speed up the implementation, and which areas have been prioritized?
I think one of the strategies around the barometer is to have an initial phase where we engage the different stakeholders in a particular policy, so that we can begin to identify what are the priority policies to look at. it is part of the process of ensuring that the stakeholders see the policy as a key issue, so that they have interest in making sure that we can follow it up as part of the barometer. So in South Africa, that's the stage where we are at, where we're beginning to say the workshop yesterday was meant to galvanize people to begin to tell them that there is this particular tool that we can use in the context of our quite sophisticated monitoring and evaluation mechanism, but to say that this tool will help us to have further engagements. Because at the end of the day, what we are saying here is that some policies sometimes don't get implemented, or they don't get implemented in the way they're supposed to, simply because people don't engage in time. To have early warning signs for corrective action, and sometimes we leave it up to the end of year evaluation. Indeed. Probably in some cases that would be too late.
Let's just wrap up very quickly, Professor Freddie. The implementation barometer, how is it tracked? I mean, is it efficient? Is it working well in Uganda?
It is a new innovation, I must say, but I think the best way to explain it is to really look at, this morning a driver was picking me from Pretoria to hit the studio, but you could see the range of gadgets in front. He had to pin in the location of the studio and the location of the hotel, and of course the speed, the distance, the air, the pressure of the, all those gadgets are just there for him to know. But government works in a sense, 5 years down the road, they commission a consultant to know whether they have arrived or not. And the barometer is to give you day-to-day idea of, are you on course? If you are encountering a problem, who do you mobilize to solve it? So that we don't wait too late to solve problems. Indeed. Or run away from nice policies because we missed a particular turn on the road or something. So this is the innovation we're trying to bring. But it's very much about engaging both policymakers, practitioners, and down in the community.
Fantastic. Sounds absolutely interesting, and I do hope that we get to see more of it and the implementation split up here in South Africa so we see it moving faster. Gentlemen, thank you. I know it's a complex discussion, but I'm hoping people got a bit of an understanding of what it was all about. The policy engagement from the HSRC, Health Economist Professor Charles Hongoro and Professor Freddie Senguba from the University of Makerere School of Public Health, that's in Uganda. Let's take